The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
Hip pain can manifest in a number of different ways. Patients will sometimes complain of soreness around the lateral or outside of their hip. Most of the time when patients have hip pain, they experience pain in their groin. It can bother people a number of different ways. Sometimes it can wake them up at night. It can be worse with activity. Sometimes they'll actually feel a true clicking or popping in and around their hip joint. Sometimes these things manifest as lower back pain or thigh pain that truly is problems inside the hip joint. Many patients, especially younger patients, will have problems that sometimes get misdiagnosed and can take visits to a couple different physicians before the root of the problem truly is figured out. Hip pain can be caused by a number of different things. In younger people, we'll see problems where the ball in the socket may be misshapen or malaligned. These can sometimes lead to cartilage tears around the hip joint. As time goes on, you can have chronic tendon tears of some of the muscles that move the hip joint. And as we get older, as our parts wear out, these things can present as arthritis in the hip joint where the cartilage in and around the hip joint just wears out. The first thing we do when we see somebody in our office is a good thorough physical examination, making sure that all the parts move, making sure that all the muscles work, check to see if one works better than another. A good physical exam can pick up a lot of different things in the office. Things that we'll utilize include x-rays, and sometimes we'll do some ultrasound-guided injections in the office to help truly figure out what the pain generator is in and around the hip joint. For patients that have problems with cartilage tears or with soft tissue problems around the hip, we'll employ different types of physical therapy regimens for stretching and strengthening of those muscles to try to restore the movement and restore the function. We'll try different injections in and around the hip joint, again, to be both diagnostic and therapeutic to try to treat the patient, but also figure out exactly what the problem is. And then we also try different anti-inflammatories to see if we can alleviate the pain with those, as well as some muscle relaxers. Our group offers both arthroscopic and minimally invasive surgery for problems in and around the hip joint, beginning with those that may just involve cartilage tears in and around the hip joint to those that involve more invasive procedures, including reconstruction of the hip joint, realignment of the hip joint, or if needed, a total hip replacement.
We hope you'll join us soon for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.